During this parenting month, we will try to understand the mental health issues of adolescents and young children. Also try to understand the important role of parenting here. Today on this panel discussion, we are joined by Member of Parliament Dr. Fazia Khan, Professor Chandra from NIMHANS and Ms. Soledad Herrero, Chief of Child Protection UNICEF, India. Thank you for joining us. We are seeing increased focus on mental health. Is it due to the stresses caused by the pandemic, or do you think it's just the tip of the iceberg?
Thank you for asking me the question and for having me on the panel. I think it's very important to realize that mental health was always an issue, except that it was not talked about as much. And the pandemic has actually brought forth all the problems that young people were facing all these years. I mean, it's true that the pandemic, because the adolescents were at home, they didn't have their peer group, they didn't have support systems, there was no school, all the things which mitigate, problems of mental health in people. Because the young people, for their mental health, it's very important for them to be in productive activity, in education, along with their peers, have sport, have play, have other forms of creativity. A lot of that had gone away, which means basically that they were left to their own resources. And because they were at home most of the time, the role of the parent also increased enormously. Parents were under stress, so they were not able to give the kind of buffering that they normally would have been able to give. So you're very right in saying that the pandemic actually brought forth a whole lot of mental health issues.
Ms. Herrero, in today's world, parents themselves are going through a lot of stress, a lot of anxiety. In this, how it affects the child, and what do you think needs to be done as a caregiver, especially when it comes to the parents?
Well, as Dr. Chan was indicating, what the global evidence shows is that 1 out of 4 people in the course of their lives will experience mental health problems. That means that a lot of parents will have to grapple with the challenges of mental health disorders, mental health issues. As a mother of a 17 months baby, I've learned in the recent past that parenting is one of the most fulfilling, rewarding experiences, but of course it comes with additional responsibility and additional challenges, especially for those parents that maybe don't have the required support system, or they themselves are also facing some mental health issues. We know, for example, that depression is the leading cause of disability across the world. When this happens to parents, it is extremely important that they are adequately supported. Dr. Chan was talking about the importance of parenting in adolescents and the conditions of the brain development. There are 2 main windows that are particularly important. She talked about adolescents. I'm sure we will be talking much more about that, but I also want to bring the perspective of the small children. The first 1,000 days of the life of any person, the brain develops at a never again speed as it does in the first 3 years. It is extremely critical, and the nurturing, the positive relationship that the parents can give will be an incredible accelerator that will bring a lot of cognitive, intellectual, and emotional development opportunities for the child. And if perhaps all this jargon sounds a little bit complex to our audience, I'll just leave a key message. Children need love, they need eat, of course, but they need play. And if there is one message that I will give to those parents, especially of smaller children, it is really through play that they will connect, that they will create bonding, that they will feel that they are loved, they will be stimulated, and it will be an incredible platform not only to have fun with our children, but also to promote the well-being and the psychosocial and emotional development of the children.
Oh, I have next question for Fazia ji. Ma'am, as a society, do you think we are prepared enough or equipped enough to deal with the issues of adolescents? And also, if you think we have enough policies to, look into the issue and address this issue?
I think mental health has always been a less focused area in our nation. So the pandemic, of course, has brought this to the forefront. But at every level, I feel a lot of institutions have a crucial role to play in as far as mental health of children is concerned. And the first and foremost is the home. So as the child is growing up, the homes need to have a nurturing environment for them where the children, they have a sense of security, emotional security. They have a feeling of being loved. They have a feeling of being important, and positive parenting plays a huge role here. So parents have to be very sensitive about how to make them disciplined at the same time and also be encouraging. So this sensitive approach is required in homes. Parents must give them a patient hearing to their challenges and problems, particularly in the age of adolescence, where they face a lot of changes, physical, psychological. So here, home plays a big role. Simultaneously, community or society also has a crucial role to play. It can be a very traumatic experience for children. So even schools need to focus, they need to have a foundational curriculum and train teachers on how to be, giving the child a free communication channel where the child can express himself to people who are mature enough to understand. And the child is not just simply torn apart by his peer group in school. So there are a lot of areas where we need to focus, particularly the government must now have a comprehensive policy which focuses well on mental health, funds it well. And, for instance, in urban areas, there may be a slight focus, but in rural areas today, there is absolutely no focus on mental health. Government hospitals don't pay attention to adolescent mental health at all. So all these things need focus today, I feel. And I'm so happy that you have brought this topic, in the forefront.
Ms. Herrero, ma'am, what do you think needs to be done? What parents should do, and especially you must have seen there's a rising, cases among adolescents which were reported about, cyberbullying this time and so many things. What do you think parents need to do?
Well, I think it's important to recognize, as it was said, that digital technologies have indeed changed the world as we know. I mean, for all of us that grew up in an analogical adolescence, we know that the reality has changed significantly. It is extremely important to first recognize the possibilities that internet brings, especially for the most marginalized groups. If we break the digital divide and we bring some of the communities that marginalized groups that have been in the dark side of internet, it will also bring a lot of opportunities for development, for exposure, for connection, for exploration of opportunities. And we need to also realize that the online world is just a platform that is here to stay for also adolescents to engage. It is interesting that when we see global as well as in-country statistics, we will see that adolescent and young people are actually the most connected cohort in the world. Globally, around 2 out of 3 young people are connected, as opposed to 50% in the general population. Of course, new opportunities come with challenges and comes with risks, as you said. I think it's extraordinarily important that we harness the potential and we learn how to limit the risks.
My next question is for Professor Chandra. Ma'am, globally, if we see in India, the cases of mental health are undiagnosed and people don't report, people don't take help. Also, there is a stigma attached to it. Now, what do you think needs to be done? For caregivers also, sometimes the children, they don't come up and bring up the issue. They're not open to talk about it. So, what do you think needs to be done?
I think very important question. I think like it was discussed just now, it's important. I'll address the second question first. It's important for parents to be able to have a dialogue with the kids, because what happens is when the moment you see your child, teenager on the phone being very secretive, the first thing that you say is stop looking at the phone, enough of internet use, enough of mobile use, and that kind of creates a block in the communication. You're not going to be able to understand what the kid is actually looking at. And maybe they're looking at Insta stories, which are inspirational. Maybe they're looking at, Facebook posts, which are talking about communicating with each other. It's not that all of it is going to be bad, but I think it's important for us to have that dialogue with kids and to also learn to accept the kids the way they are. So sometimes parents force their own values on adolescents, assuming that they know better or, being more directive, whereas a listening culture where the parent and the young person are actually able to listen to each other patiently and not just talking each other down. I think that is very important. We have a very traditional model in India of that the parent being the more knowing and the more controlling. And I think we need to kind of change that a little bit and understand that adolescents have a lot to offer us. And when we open that space where the adolescent feels safe to talk about his or her emotions, feelings, fears, concerns, that is when I think we are able to open that door or that window to talking about mental health. The other, I think, very important issue is to learn from some of the other countries which have started youth-friendly mental health spaces. Now, if you imagine, like Fauzia ma'am just mentioned, that many general hospitals, the attention to mental health is so poor. In district hospitals, the attention to mental health is so poor. So when adults who are so experienced, knowledgeable, find it hard to take help, can you imagine a young adolescent ever navigating this whole system of going to a hospital, going to a psychiatrist? It's very hard. So, for example, in Australia, they started a platform called Headspace, which are these neighborhood clinics, which are accessible to adolescents, which are very user-friendly, which is sort of co-designed by adolescents to be a space where they can play a little bit of table tennis, talk a little, hang out a little, watch the internet, and talk to a therapist. So it's a space where adolescents feel like going. So I think it's very important for India to learn from many of these evidence-based approaches across the world. These are available in Australia, in Ireland, and there is, it is important to remember that 80% of all mental health problems start between the ages of 10 to 20 years, So if we are looking at this particular window of ages, we want to create a space where young people want to come. They don't want to come to sort of impersonal hospital settings with their, very bleak kind of a place. It's very hard for them to, somehow, even if the parent drags them there, they will probably not open up. So I think the government should think about investing in adolescent mental health, creating youth-friendly spaces which don't need to be only hospitals.
Ms. Arora, do you think, mental health could be a silent pandemic? Do you think so? And what could be the consequences if this is not dealt on time?
Well, I think all the evidence available, even when it is very scarce, we know that the mental health is a relatively new domain. Even as it was indicated earlier, really, COVID has at least brought much more visibility to the issue. But all the pointers indicate that indeed mental health is one of the leading causes of poor health outcomes. 10% of the health burden, it is estimated to be linked to mental health related problems. Is this called a silent pandemic? Hopefully it's not that silent anymore. That's what I would want to say in this regard. But the evidence is overwhelming that the prevalence of mental health problems across society, and especially among young people, as Dr. Chan was indicating, right? 1/4 of the population will experience some level of mental health problems. Globally, 1 out of 7 adolescents might be already grappling with mental health issues, and 80% of them will happen during or will start to be developed in childhood. So clearly it should be a priority problem. I think some of the solutions were already indicated. It needs to be everybody's business. It needs to be discussed. It needs to be holistically addressed. It needs to be part of not only the health system, but we need to put much more emphasis on preventive and community-based programs that talk about psychosocial well-being, and we don't have to wait until a mental disorder takes place. We are talking, of course, today about the unique power and unique role that parents can have. If parents can develop resilient well-being models and can show capacities to cope with distress, adversity, the chances are that the children will be able to emulate and have much more resources also to deal unavoidably with some of the psychosocial challenges that life will throw at them. And finally, of course, we need resources, we need capacitation, we need to have cadres of specialized professionals that deal into this issue. And it should really be a joint effort across the board, from private sector, public sector as well, communities and families at large.
Thank you so much, ma'am, for giving your time. Thank you, Dr. Fauzia, for joining us, and Professor Chandra, for joining us. Thank you so much for your time. It was a pleasure talking to you and to have this important discussion. Thank you.